Hi everybody. The purpose of this video is to demonstrate the process and procedures for performing a manual muscle test in order to assign a strength grade for your patient. So in order to demonstrate this, we are going to assess the strength of the quadriceps. And for today's video, we're going to assume that Dr. Tiller's left knee is the affected side that we are going to be testing. So before we ever apply resistance to a body segment, there are steps we need to take first so that we have a comprehensive and accurate picture of what's really going on. So we want to assess active range of motion of the unaffected leg first. So Dr. Tiller, would you mind kicking your leg up into a straight position? Good. And bring it back down. That feel okay for you?
Mm-hmm.
Great. I'll ask you to do the same thing on the left side. Okay, and she's achieving full active range of motion. I'm actually going to have her do the active range of motion of the affected side again. This time it's for the purposes of me being able to palpate the primary muscles. Obviously, you guys already know that there are 4 primary muscles that make up the quadriceps. I'm likely going to first palpate the rectus femoris. Go ahead and kick your leg up straight. Good, and relax. You could also palpate the vastus medialis or lateralis. I'm then going to ask her to perform active range of motion a 3rd time, and this is where I'm going to apply my graded resistance. Before I do that, I need to be thinking through where I'm going to stabilize. So it would be inappropriate to stabilize on the top of Lisette's thigh because I would be stabilizing over the muscles that are actually trying to do the work. So that's a way that you can remember where not to put your stabilizing hand. You don't want to stabilize over the muscles that are actually working. So my stabilizing hand is going to be underneath her thigh. I will ask her to go ahead and kick the leg straight. Before I apply resistance for the knee, I'm actually going to ask her to slightly bend or unlock the knee. And this is so we don't put undue pressure on the knee joint that is fully extended. So now what I'm going to do is apply some resistance. You let me know if it hurts, and I will stop. So I'm going to apply graded resistance. And she's giving a little bit to my maximal resistance. Go ahead and relax. So I would grade that as a 4 out of 5 because there was a little give, but she was able to hold generally against my resistance. Something else to note about applying resistance during manual muscle testing, you definitely want to make sure you're doing graded resistance. You don't want to, go ahead and straighten your leg for me, you don't want to come on fast and forceful with resistance. You're going to get this rebound effect and you might hurt your patient and you're not actually going to get an accurate assessment of what their muscle strength is. So when I apply resistance, I'm actually slowly but strongly getting to maximal resistance, okay? And since she gave a little bit, or she broke in that test, that I would assign a 4 out of 5. Now Dr. Tiller is going to demonstrate what a 5 out of 5 would look like. So go ahead through the whole range of motion. I'm stabilizing. She's unlocked a little bit, and she's not moving against my maximal resistance. And go ahead and relax. So a grade 3 out of 5 would be if she could move through the full active range of motion, but when I go to apply my resistance, she gives right away. So she's really not able to maintain any muscle force or any strength against any resistance. You cannot assign a grade 3 until you've tried to apply resistance. So you can't just see a patient move through the full active range of motion and say, okay, they're a 3. You need to actually try to apply the resistance to determine the difference between a 3 and a 4. So let's say she went through the active range of motion and she was unable to go through the full active range of motion in this against gravity position. This is when we would need to go into a gravity minimized position. So since I already know that her right leg or her right knee can move through that range of motion, I'm going to just assess the left knee extension in the gravity minimized position. So Dr. Tiller, if you wouldn't mind laying on your right side facing me, and I'm going to come around the back. So the tricky part about doing a gravity minimized assessment like this is that I'm going to need to support the weight of her leg so that she has freedom to move. I don't want her hitting her foot or the table. So I'm supporting the weight of her leg, but I'm not helping her move, and that can be hard sometimes. I'm starting her in some knee flexion because I want to see what her strength is moving from knee flexion into knee extension. I'm starting her at about 90 degrees of flexion. So Dr. Tiller, I want you to try and move your leg into a straightened position. And I'm just supporting the weight. I'm not helping her move, watching and feeling. And she's getting to full range of motion. Great, and I'm gonna have you relax. So if they can get through full range of motion in a gravity minimized position, I can assign this a grade 2 out of 5 for left knee extension. Let's say I put her in this gravity minimized position and she was only able to achieve a partial range of motion. So if she's only able to achieve partial range of motion in a gravity minimized position, for the purposes of this class, I would assign that a grade 1. In some clinical settings, you might hear that be assigned a grade 2 minus, but we're not focusing on pluses and minuses in muscle grades for this class. So I would assign that a 1. The other way I could assign a grade 1 out of 5 would be to palpate a trace contraction. If you're palpating a trace contraction, sometimes it's easier to feel if you put them back in the against gravity position. So I'd actually have her back in supine. I would be palpating. To determine a trace contraction, you must have accurate palpation because you're not seeing any movement happening. So let's say I want you to try to straighten your leg. And what I'm feeling, and I know you can't see it really right now, but what I am feeling is contraction in the rectus femoris and in the other quadricep muscles, even though no movement's happening. So that would meet criteria for a grade 1 or a trace muscle contraction. So to quickly review, when you're generally doing a manual muscle test, you will have the individual move through active range of motion of the unaffected side. Then you will have the person move through active range of motion of their affected side. You will have them move through active range of motion of the affected side a second time. That time you are palpating the primary muscle, and we will ask you to identify that. Then they will move through active range of motion of the affected side again. That is when you apply your graded resistance in order to assign a muscle grade of a 1, 2, 3, 4, or 5. You will record the manual muscle test as out of 5. So what I mean by that is Dr. Tiller's test would be recorded as a 4 out of 5 on the left knee extension.